meeting is called to order. Now, our first agenda is to confirm the minutes of the previous meeting. The previous meeting minutes were circulated, and as we have not received any objection or observation, I presume that everyone has confirmed the previous meeting. I hereby confirm the minutes of the previous meeting. Now, today, the next agenda is for our topic, which is a very, very important topic.
Just 1 second. I am looking at who's not mute.
Yes.
I'm sorry. Yeah, I'm on it.
Yes. Okay. So today's topic is a very, very special topic, and that is physiotherapy for healthy organs. Because we all are dealing in organ donation, and as you all know that organ donation or organ transplants are taking place only when the organs are either very healthy, then only the organs can be donated, or they are unhealthy or they are failed. That's why the transplantation is taking place for the recipient. Now, how to keep our organs healthy? That is a very, very important thing. And to keep organs healthy, we require either our lifestyle has to be in such a way that our organs remain healthy. And for that, today we have a very, very important, or I must say, very eminent person who is going to give a talk on this. And to introduce her, I would like to invite Rotarian Jignasha to introduce our today's guest speaker. Rotarian Jignasha, please.
Oh, hi, good morning. How are you guys? Thank you, Mr. President Lal Gohil. Thank you, dear all fellow Rotarian, and our secretary, Mr. Praful Agrawal. This is for Dr. Supriya Khandelwal, PT or compassionate physical therapist with a patient-central approach. With over 17 years of experience, Dr. Supriya Khandelwal is a seasoned physical therapist dedicated to deliver exceptional patient care. As the head of the Department of Physical Therapies at Saraswati Hospital in Mathura, she emphasized physical therapies is more treatment. It's about empowering patients to reclaim their quality of life. Mr. Khandelwal holds a bachelor degree in physical therapies from IPH&H, master in physical therapies from Sanskrit University, UP. As a pre and post ortho rehabilitation specialist, Dr. Khandelwal has honed her skills in premier institute like RBTB Hospital, Kingsway Camp, Delhi, Sanjay Gandhi Hospital, Delhi, Nayati Super Specialist Hospital, Mathura. As the head of the Department of Physical Therapies at Saraswati Hospital, Mathura, Dr. Supriya Khandelwal leads with a commitment to patient-central care, a focus on empowering patients to take controls of their health, a passion for delivering exceptional patient outcomes. Dr. Supriya Khandelwal believes that physical therapies is not just about the treating the physical body, it's about understanding the patient unique needs and goals. By combining evidence-based practice with the compensated care, we can empower patients to achieve optimal health and wellness. I want to just add a couple of things. This is also, my daughter is also Doctor of Physical Therapies from prestigious U Sciences University of Philadelphia. She is also currently consulting travel therapy. She is also looking for specialists in future. And physical therapies date back in Ancient Greek and Egyptian time. The first physical therapist is a woman. Last, Dr. Supriya, I am very impressed. I am with your community service and skills making patients' life better. Thank you.
Thank you, ma'am. Thank you. Thank you for such a elaborated introduction. Hello, good evening to everyone. Myself, Supriya Khandelwal. I am working in Saraswati Hospital We are taking care of pre and orthopedic rehabs. But today's our topic is how we can keep, how physiotherapy can help a organ healthy. So first I want to tell you about physiotherapy mainly focus on prevention, treatment and rehabilitation. But nowadays due to our sanitary lifestyles, due to our sitting habits, our organs are also needs a care. So as a physiotherapist, we are the core trainers of the muscles. We are the core trainers of musculoskeletal system. So that's why physiotherapy there where its physiotherapy plays the role. Nowadays everybody is sitting and they did not get the time to do some physical activities. People are busy in their work schedules. They have a long hours schedules. They are not able to do any of the physical activity. They could not able to do the physical activities because of their lifestyle. So physiotherapist is the person who can teach them a simple and core exercise for the internal and the external muscles of the body. So now the organ of our body are held by the internal muscles, which we most of the time we are talking about quadricep, hamstring, abdominal, abdominal training, these kinds of things. But there are the internal muscle which should be treated for the healthy organ. So physiotherapist is the person which can help you in the core training of the organs like the heart, the lungs. Lungs require a lot of exercises. Like for the lungs health, for a good lung health, you require a lot of exercises. Like sometimes people say that why not we can go to a fitness trainer also for these kind of things. But there is a difference in a fitness trainer and the physiotherapist. Physiotherapist, they know where to go, where to stand, how much we need to exercise, how much, where to stop, how much, where our BP is lying. They will take care of their past history also. If you have any of the like, sometimes people do a lot of cardiac exercises and their heartbeat goes up, their palpitation started. Fitness trainers sometimes could not able to recognize what is happening with the person. So if you're doing these things with a physiotherapist, you can physiotherapist can easily make out what exactly is going with the person. Like sometimes when you are doing yoga, sometimes you do lot of stretching because of the excessive stretching, excessive speeding. Sometimes you put lot of pressure on your lungs, which should not be required. You are putting lot of pressures to the lungs, because of it you get palpitations, you got breathlessness. So where that's why physiotherapist is the person which can help you poorly. And in day-to-day life, physiotherapist is a person who can teach you two, three simple, like for keeping the organs healthy, they will recognize the earlier signs of the organ damage, organ problems. So we can teach them a simple thing, simple exercises which they can do while walking, running, sitting, or doing any activity. Like there are simple exercises which can be taught during these things. And physiotherapist, again and again, I'm telling one again and again, I'm saying one line, that physical trainers are the core trainer of muscles. We are dealing with the musculoskeletal system, and people are not understanding that organs also requires a core training for the muscles, like the lungs, like the abdominal muscles. Sometimes pelvic prolapse is very common in women's. This happens because of the weak pelvic muscles. So and because of the weak pelvic muscles, we get kidney dysfunction, kidney infections. Sometimes we get a this bladder incontinence also. Sometimes we got, women don't understand because of the obesity and all, they got in incontinence. So it's a common thing. So I have made one simple presentation for everyone who are listening to us. It's a simple thing, like we are just discussing the simple exercises. So I'm just sharing my screen. I hope everybody's listening me and everybody's understanding my points. So I'm just first sharing my screen.
Yep. You can come to page 1. This is right now it is on page 1.
We have 12 organs, different 12 organs in our body, but I am discussing few of them, and we are not discussing all organs. And in this presentation, I will be teaching two, three simple teaching. What means I will be explaining 2, 3 simple exercises for each and every organ. Like physiotherapy is all about individual counseling, individual fitness program for everyone. So we'll decide according to it. Now, first we are talking about lungs only, because lungs are something which, if the lung will be healthy, heart will be healthy, heart will be healthy, muscle will be healthy, muscle will be healthy, kidney will be healthy. So this is all a cycle. So all this is regulatory. So first I'm discussing with my lung thing. First organ which I'm discussing is lung. Lungs work harder to supply additional oxygen. Breathe out, breathe out, breathe in, breathe out techniques are very important. So first exercise is diaphragmatic breathing. All we know that diaphragmatic breathing is very helpful. People don't understand this breathing, but it's a very, very tricky breathing. Like normally we breathe in by nose, take out our exhale by mouth. But in diaphragmatic breathing, we have to put our hand on an abdomen and simple breathe, inhale the oxygen and pull out our abdomen. Like we have to push out our abdomen by inhaling and then breathe out by mouth. It's a simple thing, but it diaphragmatic breathing goes till the alveoli, till the end of the lung part, alveoli. So this is very simple exercise. First exercise, diaphragmatic breathing. Second, pursed lip breathing. You just have to make a whistle position, like the way we do a whistling. Just whistle the makeup out of your lips and then breathe in, breathe out. These are the simple exercise which we can do while running, walking, sitting, lying. When we are working, we can put a feedback also on our laptop. Like we have to do a lungs exercise. You put a red bindi on your laptop that gives you a feedback that you have to do some exercise. If somebody is having difficulty in breathing, they can put a feedback on their working place, so that they'll recognize and they will understand and they will start doing those breathing exercise while doing any work. Like deep breathing, simple deep breathing. Just you have to understand, you have to listen, you have to focus on your breathing. Just breathe in and breathe out. This is a simple you can do in 2 minutes while doing any of your work. Take a break of 5 minutes and just close your eyes and do these exercise. It will be like very helpful for your lungs, and it will automatically lead good health to your heart also. And like we can do cycling. Like cycling is something which people can do in the morning time. So we are discussing only the time when people don't get, we are discussing exercises for those people who don't have the time for the main physical activities, like the actual physical activities. Now, very important thing which I want to discuss that only physiotherapists understand. The poor posture lead to the bad lung health, like scoliotic, kyphotic, humpback. It's a common problem. Scoliosis is very common in men, especially in 25 to 35 years old men and women also, but mainly it is seen in the men's, because they are sitting all the time on the laptop, or maybe they are doing some work in the sitting posture, or they are standing. Sometimes the people who are standing too much, they slouch their necks, and that posture, that spine goes into a little tiltation position like this. Like spine, when you see from the back in the x-ray, it will be like this, but in the scoliotic patient it gets like this, and this gives pressure to any of the lung, right or left, whichever position the 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 spine tilts. So this is also one of the reason in the scoliotic patients, sometimes they feel breathlessness. They don't understand why it's happening. Hard lung, the pressure on the lung, and then the humpback.
One moment.
Then,
Yeah,
hello.
please go ahead. Yeah, please go ahead.
Yes. Like for the hum back also, like the people having posture like this, their back is little like their upper back is little tilted, like kyphotic patients, like kyphotic people. They have very bad lung. They have a difficulty in breathing. They don't understand why it's happening. So it's because of their posture, because of their bad posture, their lungs are getting pressed, and they did not getting the full air inflow and outflow of the air in the lungs. Now I'm discussing my next organ, heart. As we all know that to keep our heart healthy, we should eat apple, we should do a walk, we should do some fitness training, we should go for a fitness uh, walking, running, any of the activity like swimming. People do swimming, but it's about the people who could not able to do these physical activities. How they can keep their heart healthy? Like simple thing you can do while when you are sitting. You just lift your hands, lift your legs, put your legs up and down. Simple things like rotate your elbows so that the muscle which are contracting, relaxing, they get the stimulation. They they they'll get a increase in the blood flow internally. So this in this way we can keep our heart healthy. There should be a regular checkup of BP. uh, like if you are doing any of the lungs exercise also, that also automatically gives benefit to the heart also, like there is a increase in the blood flow. Like as we it's written in my this presentation also, the physical therapist will work with to improve your ability to active and implement. Like we can implement simple things, like again I'm telling the same thing, that you have to put a feedback. If you have a difficulty, like if your heart is not healthy or you want to keep your heart healthy, just sit on your table and just do start doing this jogging movement for 5 minutes. That can keep your heart healthy. You know? Now, now the next important thing is kidney and the bladder. Again, I'm discussing one important topic, that while sitting, we are putting pressure on our abdominal muscles. So there are two things. Abdominal muscle should be strengthened, and for kidney health and for the bladder health, pelvic and abdominal muscle should be strengthened. So when we were sitting, we are putting pressure. We are just like we are slouching. We are going back. Sometime our abdominal muscles get, because of the pressure, our abdominal muscles are pressing, and because of the pressure our kidney get pressure. We could not able to feel for the urination. We for the long hours we are not going for the urination, and that gives pressure to your kidney. And leakage of the bladder also gives infection to the kidney, and that we don't know. We thinking that it's a normal thing, that something we are just sitting, that's why it happened, that leakage problem happened. And for the long hours, like for the 5 6 hours we are not urinating, we are also infecting our kidneys. For that, first important thing is that you have to walk. You have to release your abdominal muscles. You have to simple exercise like just tuck your abdomen while sitting, keep pressing your abdomen back. And one more important exercise, when you are sitting, you can lift your legs up and down. This also strengthen up. Like first you have to come at the edge of the chair, and then you have to lift your leg. This is a very good abdominal exercise. People don't know this. This is the exercise which is a core abdominal rectus muscle exercise. You just have to come to the edge of the chair, and then you have to lift your leg. This is also strengthening your quadricep muscle also. Both muscles are getting strengthened, abdominal and quadricep. You just have to come to edge of the chair. I could not able to explain this exercise while showing it, but I just can explain you that you have to come to edge of your chair, and then you have to lift your leg up to up to up to the abdomen, like up to your groin, like this. Like if you have to lift your leg up like this. This is your chair edge. You are till at your chair edge, and then you have to lift this up. Just lift it this. This will strengthen up your quadricep as well as abdominal muscle. And if you strong your abdominal muscle, that automatically helps to keep your kidney and bladder strong. So this is the point. Now, my next is, now one more important thing is Kegel exercise. Kegel exercise are the exercise which are very beneficial for the pelvic floor, for the abdomen, for the bladder, for the liver, and for the fatty liver also. When you are going on the sleep, suppose if you are going for a sleep, you have a long hour, you work so hard, but you are not getting the time to do something. So you can, when you are lying down, again you have to put a feedback in your mobile phone that I have to do this Kegel exercise while going for the bed. So when you are going for a bed, just do simple 4 Kegels exercise. Just lift your back up and down. This will relax your abdomen also. This will relax your back also. And this and one more thing, one more important Kegel exercise for the bladder is when you are going for a urination, you have to hold your urine again and again. When you are going for a urination, you just have to hold your urine. This will strengthen up your internal vaginal also, and your bladder also. This is for both the sexes. You have to hold your urination while going for a urination. Again, you can put a feedback on this in your mobile or something. Same thing when you can do four Kegel exercise while going on the bed. Like first is bridging exercise, very common, and then you can fold your legs and push it inwards. Like your legs are like this, you have to just push them like this. This will strengthen your internal adductors, which are very important for the pelvic floor muscles, and it will keep your kidney and bladder healthy. So these are the 4 Kegels, and another one is that holding a urination, third exercise, and the fourth exercise is the cat and camel exercise. The child pose is also one of the part of the Kegel exercise, which is very relaxing. That will relax your back also. And now the another important issue which I want to share with you, that fatty liver. Fatty liver is like most of the people having nowadays, like even the 30 year person is 30 years of person is having a fatty liver. So it is also a very important topic to be shared, to be take care, organ to be seen up to it, that fatty liver should be treated nicely. It should be like you have to keep your abdomen strong. You have to like the you have to the fat on your abdomen should be seen. Like if you are putting a weight on your abdomen, you have to take care. You have to start doing simple exercises, just tucking your abdomen while sitting, just lifting your legs, and simple exercise. Like agar if there are another level also, if you go to physiotherapist, they will tell you simple abdominal exercises which you can do in the morning hours. So this is one thing. And if you will do all this exercise, I hope your brain will release endorphins and you'll be healthy. Your brain will be healthy. Physically, mentally, you will be stronger. You keep your organs healthy. Now I have put it these 4 5 exercise, walking daily, stair climbing, you can do at your workplace also. If you don't use lift, you can use stairs, chair squats. When you are on your laptop or you are at workplace, just sit and stand and do squatting. Very common thing, you can do it easily. Like again, wall push-ups that you can do in your room or where or at your office also. Abdominal crunches, this I'm telling again and again, this exercise. It is very useful exercise while sitting. And then shoulder presses, like simple shoulder exercise that keep your heart and lung and pectoralis, all these stronger. So this is all my presentation. I hope everybody understands it and understood my point of view about physiotherapy organ health.
Thank you very much, Dr. Supriya Khandelwal. Just please close the your presentation. Yes. So thank you very much, Dr. Supriya Khandelwal, for giving the presentation about how the physiotherapy can help to keep our organs healthy. Because this is something which is disturbing everyone. Because right now, as we are seeing on the newspapers and others, that many deaths are taking place when a person is going to a gym and doing the exercise and they are collapsing with the heart attack. And secondly, you have raised the point also about the lifestyle. So what we are seeing, but rather not, we have read in the newspaper also that the 20% of IT professionals in Karnataka are now suffering from the organ failures, and that is a very alarming thing. Now, these two things, which shows that either we are not doing proper exercises in gym, or secondly, we are not doing exercises when we are on laptop or when we are doing lots of work with stress and whatnot. Can you just explain about the deaths which are taking place in gym when they are under the supervision of a trainer there, because the trainer is always there, why it is taking place? And secondly, about the IT people, professionals who are doing work, bringing so much foreign exchange to our country, and they are now suffering with the kidney, these problems about the organs. So how we can see to it that they will come out from these problems? Dr. Supriya, please.
First, I want to talk about fitness trainer. When you are going to the gym, you have a one agenda that we want to lose the weight, we want to build our muscles, we have to look like this, we have to do this. But the problem comes when you are over stressing your muscle. The energy in the muscle is so much that oxygen flow is not proper. The oxygen level go up, the carbon dioxide levels comes down. The breathlessness, the over exercising. Initially, first in the first lung topic, I discussed this thing that over breathing, breathe out, also inhale, exhale ratio is also disturbing. That also gives pressure to the lungs, and we could not that lung pressure lead to the heart pressure, and that heart pressure leads to the cardiac arrest, the fallouts, the cardiac arrest. This is all happening, and fitness trainer is not understanding. He's just thinking that you are doing, oh wow, you are doing this exercise for such a long hours. You are just doing it, and you are not understanding that your body is palpitating, your oxygen level is going up, your carbon dioxide is coming down, that the breathing pattern is inhale exhale process is getting disturbed, and sometimes you are lifting so much weight. Because of the weight lifting, you got the injury in the muscle, and that gives low BP to your low pressure. The sudden injury to the muscles gives decrease your BP, like your BP comes down, and the fitness trainer won't understand what is happening, and then it affect on your heart, and that leads to the cardiac arrest. I'm discussing everything in a layman term. I'm not going into the medical things.
No, we want in a later, because we are not doctors, except few of them. Yes. And the second is about the IT professionals.
Yes. Second, about the IT profession. I'm saying the same thing. IT profession problem is that their bladder thing, their kidney problems. Because of their kidney problem, that leads to the organ failure. Because they are not going for a urination for long hours, they are just sitting. Their abdominal muscles are also getting weak because of the sitting. That's why they are getting these organ failures.
Okay. So thank you, Dr. Supriya. Now I'm opening this for everyone to ask the question one by one. So yes, please start. Just unmute yourself and ask the question.
Can I?
Yes, please.
I really appreciate, and
yeah, please go ahead.
And thanks to Dr. Khandelwal, because I am one of the beneficiary of a proper training through the physiotherapy. And since I'm going and attending classes, there, from muscle to your mind, because there is a yoga class in the same, there is a strengthening classes is also happening. So all your muscles, all your what she has told, everything gets. So I got recently tested. I went for the separate test in the separate hospital. I got everything tested, and it is found to be okay. All my lungs, all my kidney, heart, everything is found to be okay because of the exercise under the supervision of a trained physiotherapist. I go to the college. There is a college there, and I am regularly going. So there is a 7 days, 6 days program, Monday to Friday, and all days there are different, including aerobic is also being taught. I practice in, and the TheraBand is also being taught. Even the weightlifting is also being taught. So there is a absolutely scheduled one after 1 hour, one, at least this is for 1 hour. And I'm really thankful to you. You have also highlighted very nicely in a number of things which you have said, and particularly the youngster, they are not doing it. I am now senior citizen, but I go on a very regular basis. My wife and both I go, and we have seen the benefit of physiotherapy. We have felt it, we have seen, and therefore we have started practicing. So thank you very much, and really it was a wonderful program.
Okay, thank you very much, Ramnath
Thank you,
Pradeep ji.
doctor.
Now, next question, Rotarian Deepan Shah has raised the hand. Yes, please. Unmute and ask.
Yes, thank you, Mr. President Lal Goyal, and hello, all fellow Rotarian. And I'm very, very impressed with Dr. Supriya Khandelwal. And in fact, I am currently going for physical therapy. The reason I started aggressive, intensive exercise, the one you says I would like to be fit and making my muscles build up, and those kind of end up with the ER, and then I am doing therapy. I'm doing much better, and what I understand, it was very, very detailed, oriented presentation. Some of the notes I also took it, and I may try to follow it also. And in America, there was a first physical therapist was a woman. In fact, very proud for women also. And what I understand and learn, children can be also benefited from physical therapy that include mentally situation children like autism, Down syndrome, also cerebral palsy was also treated with physical therapy. And then there are more than one type of physical therapy, not only musculoskeletal physical therapy, but cardiopulmonary, neurological, sports, geriatric, pediatric, orthopedic, and upslope physical therapy. So you physical therapists, as a Dr. Khandelwal, you and other therapists, you are the first line of defense in human life and bringing people's life back to normal. So I'm very pleased with your wonderful, noble help to the community and helping our Rotary Club to educate us also. Thank you so much.
Thank you very much, Rotarian Deepan Shah. Now, yes, Rotarian Professor Dr. Sudhir Saran.
Thank you, Dr. Supriya. It was a very clean and clear presentation. I got to learn some of the basic concepts. I see something which, is happening in real time. Our Rotarian Jigna is rolling something with the rolling pin, which reminds me of a relationship between physiotherapy and acupressure. Is there a connection? Can they be complementary?
So see, acupressure is acupressure is on the muscles, nerve fibers. Like we take the root. There is a difference. Physiotherapy is an overall thing. We have a vast variety of things, like the Dr. Ramanathan said, Mr. Ramanathan said, ki there is a pediatric therapy also. There is a cardiopulmonary therapy also. We are autism, CP, everything, post-orthopedic rehab, pre-orthopedic neurological conditions, pediatric conditions are there. Cardiopulmonary, after the COVID, cardiopulmonary physiotherapy is something which is coming up very highlighted very fast. So the acupressure is very small field of, acupressure is something which is very small in front of physiotherapy. Physiotherapy is leading with every organ, every part, in every aspect of body. And the acupressure is only leading to the muscles and to the nerves. They are acting on a muscles and the nerves. They are taking the path of nerve and treating those muscles which are passing through those nerves. So acupressure and physiotherapy is totally different. There is a
One more question here. In any profession, there are very competent professionals, average competence professionals, and low competence professionals. In physiotherapy, the same thing will prevail. So, what kind of risk does a person face if the physiotherapist is either average competence or low competence professional?
because there is a difference, sir. The advanced competent person will teach you a core things. They know the muscle, nerve, tissue, ligaments. They'll teach you a simple 5, 6 things. And if you are going to a low competent person, he just know the simple 5, 6 things, and he'll teach you 5, 6 things. Matlab, he will not be able to focus on the core problem of your muscles or any of joint or prevention or treatment or rehabilitation. There is a vast variety of rehabilitation every day. Even if I am an experienced therapist, I am also learning day by day, because every time so I cannot question on anybody's competency. So it's depend. You will understand when you go to therapist. You will automatically understand who's average, who's
Good.
Thank you very much.
Thank you very much.
Thank you very much, Professor
want to
Dr.
ask one
Supriya.
small
Yes, Rotarian Himlata ji.
Yeah, good evening, Supriya ji. It was very fantastic program.
Thank you so much.
I want to know the causes for the back pain in females. Actually, what are the risk factors, no? Like genetic they're having, and then poor posture is there. Then they're having female hormonal changes are there.
Right.
Like menstrual cycle, and then premature, all those things, post-menopause, all those things, no? Then pain conditions are also there for them. And some people are telling you should not lift all those things. For that, any exercise is there for them, or it is a permanent thing for them?
No,
like
no. I'll tell
like
you.
uterus removal, all those things, no? For female, it is more actually.
First,
And the pain condition are also more like that. Like joint dysfunctions and all those things.
Right.
So what do you suggest for that?
Yes, ma'am. First important thing is investigation. Vitamin D, vitamin B12, uric acid plays very important role. Muscle strength, because with the age, at the age of 30 to 40 is the age where our muscles get weak. Because of the weak muscle, that is going to our joint, and in between that the vitamins plays the role. The hormonal changes, the vitamins deficiency plays the role that gives stress to the joint. Now this stress, if this stress happened, we cannot do anything. There are the surgeries for those stresses. There is a vast variety of things. If you have a slip disc, then there is a different problem. You must have got any injury also. Sometimes we lift the weight, we got that disc bulge. Continuously, repetitively use of the joint, repetitively stressing your back leads to the pressure to the joint, pressure to the disc, and that leads to the continuous back pain. This continuous back pain leads to the disability to the joint, and then posture changes, and that posture changes is continuous pain. So there is a stage for every thing. There is a stage at every age. At the age of 30, you have a different problem with the back pain. At the age of 40, you have a different problem with your back pain. So the proper first there should be a proper investigation, and then after the investigation we can tell all the exercises according to the situation of the joint. With every joint, even with the back, with the knee, with the shoulder, frozen shoulder, you have seen very common. It happens because of the diabetes also. Sometimes, all the time, your supraspine, there is a rotator cuff injury, which is very common while pushing, when you open your door, close your door, this leads to the rotator cuff injury sometimes. It's a very common thing. So there should be a proper investigation first. Then according to the joint situation, we teach the exercises. And there are different exercises. Like if you have a disc bulge for a backache, we have a different exercises. If you have a normal backache, there are in the last Rotarian conference, I talked about hamstring tightness. So
Dr.
because
Supriya, it was not a Rotary conference, it was another conference, it was an international conference. Yeah, sorry. Yeah, please go ahead.
it's on the therapy day. So we discussed about hamstring tightness. So in the early stages, there is a hamstring tightness. The hamstring tightness leads to the disc bulge and disc pain. That leads to the further problems like the sciatic nerve compression or the slip disc, the prolapses. That all happens afterwards.
Okay.
So there is a every stage there is a different pathology with the spine.
Okay. Thank you very much, Rotarian Hemlataji. I think Rotarian advocate Ramesh Sharma wants to ask.
Everything, everything is very clear. She has made everything clear.
Okay, so there is no question from your side.
No question from my side.
Very good.
Sir, one small thing, sir. Even can I ask one small?
Yeah,
question?
please go ahead. Please go
Even
ahead.
calcium also, they are telling you should not take too much of calcium for the bone infection, all those things. So what do you
Right.
say? Calcium
That's
also,
That's why in the first I said there should be an investigation for all
Then,
vitamins. First, there should be investigation. People are like nowadays, just they have listened that weakness of calcium leads to the weakness.
Yes.
The deficiency of calcium lead to the weakness in the bones. That is not true. Vitamin D also plays a role. Vitamin B12 also plays a role. And there is sometimes uric acid also plays a role. Because of the increased uric acid, you got lot of pain in your muscles and bones. So there should be a proper investigation. And according to the investigation, we'll decide the exercises. And there are sometimes weakness of the muscles also. With the age, your muscle get weak. Everybody know about it. There is a weakness of collagen, protein, deficiency of protein. That also leads to the weakness in the muscles. So investigation is first, vitamin investigation is important. After that, we should take any of the things.
Okay, thank you very much, Rotarian Hemlataji. Anyone else wants to ask any question? Professor Dr. Rohan Mones, you want to ask any question, please? Dr. Mones, are you there? Rotarian Sunil Gupta, you have asked,
Yes,
you wanted to ask question. Yes, please. Go ahead.
I would like to ask a question. Dr. Supriya, this was a very insightful presentation. Thank you very much. Now, as the body ages, you talk about muscle dystrophy or getting weaker, right? If you don't use a muscle, it kind of muscle memory gets, you can't really bend all the way and touch your toes and things like that. In the science of physical therapy, I've gone to physical therapy for multiple reasons, for frozen shoulder or in my knees, etc. Are there, I've seen people using the TEMS machines, which passes electrical signals to kind of stimulate the muscles. Are there things that we can actually, to preserve proper body function, invest at home, like certain machines, because of advancement of technology, that can help with physical therapy and making sure we are fully functional, whether it is your posture or cramping, etc., etc.?
No. Only medical, physical, the physiotherapy equipment cannot help you. This is just a relaxation to your muscle, just to increase the blood flow to your muscle. That the only TENS therapy cannot help you to get rid of this joint weakness. This is your question, huh? I think.
TENS machine, but how do you reverse dystrophy of the muscle? That was my question.
How you reverse the stiffness of the muscle? By stretching,
हाँ, like जो weakness हो जाती है muscle में, dystrophy हो जाती है, उसको कैसे एक तो prevent करना और कैसे reverse करना?
Reverse, okay, you want the reverse solution. Reverse solution is exercise and stretching. If you have a stiff muscles, you have to correct your postures. There must be some problem with your posture. That's why your one side muscle is getting tight. So you have to do the stretching. You have the physical therapist will see you and they will understand which muscle is getting tightened, which muscle is getting weakened. So we have to understand the muscle anatomy first, and then we can reverse this stiffness. by stretchings, by doing simple strengthening exercise, core exercises for that particular joint. Stiffness can be reversed, and by doing simple heating, hot water fermentation, that will be very helpful for you. Sometimes icings for the for the trapezius, we use ice therapy. It's very common. Ice therapy gives good result in
Yeah, that's even I wanted to ask that one.
one.
Because even small children, they are wearing specs nowadays. So this eye exercise, it will be very useful for them if they do continuously.
Yes, we have a if we do a lot of nowadays the children are watching a lot of mobiles.
Yeah.
They are focusing on one thing, and the light also plays the roles. Their muscles are getting weak, they are getting squinted also. So eye exercises plays very good role. There are so many good eye exercises that
So
we
it is
do.
helpful, really.
Yes.
Yes. So thank you very much, Rotarian Sunil Gupta. I hope that you got some clarification. If you have any other question, you can ask right now.
One more question. Sorry, I don't want to hog the time here, but the role of massages. I've seen a lot of new stretch massages places that have opened up that tend to help, because there are a lot of IT people sitting on computers all day long. So what is the role of massage in terms of, I know you talk about relaxation, but functional health, right?
Massage
I know massages were such an important part of our culture, right?
Right. I don't know what kind of massage you are talking. If you are talking in terms of physiotherapy, it is called MMR technique. That is called muscle mobilization technique, release. Muscle mobilize, release. This is a technique in which we just release the muscles taut. There is a taut band formation in the muscles that leads to the pain that puts the pressure on the fiber of the muscle. So we just massage that taut bands of the muscle. So this massage physiotherapists do. The massaging technique, if you are saying that people are going for a simple massage technique to the parlors and all, that just increases the blood flow to that muscle. That's it.
So you mean to say, Dr. Supriya, that one must go to a physiotherapist for the massage also, not to go to a beauty parlor for the massage?
No. I'm not saying this thing. Massage is not related to the physiotherapy. In physiotherapy, we are doing different techniques for the massage. We call it a massage technique, but we are not doing what the other are doing. This is what I'm saying now. We are just releasing those tauts in the muscles so that you'll get the relief in the pain. So our focus is not to relax your muscle. We just want to relax your pain.
Okay, but because sometimes orthopedic doctor says, don't massage it, otherwise it will aggravate the pain or aggravate the disease.
Right, at the bony places. See, it's very important. People talk about massage and massage. Massage is only for the muscles. Massage is not for the joints. If you'll massage your joint, what will happen? Like there is no muscle, only ligaments and tendons are there at the joint. And even in the shoulder joints also, there are so many internal ligaments are there. So the rotator cuff is going upward. If you'll massage that rotator cuff, that will come down. That will give pressure to that particular point where it get it inserted. The insertion point of the joint. So it's very important. Massage is something else. Everybody have their
Okay. Thank you very much. Thank you, Rotarian Sunil Gupta. Rotarian Monis, now you are there. You have any question to ask?
Good evening, Supriya. Very insightful presentation. Thank you so much. Just to add to what Supriya mentioned, I mean, even Rotarian Sunil Gupta's question, what happens is after the age of 40, you have a loss of the ideal muscle mass of the body is lost at the rate of 2 to 5% every year. Okay. Yes. So as you age up, this becomes like a compounded thing. Now, on a preventive ground, it's a very composite and a very comprehensive requirement. We talk about nutrition, we talk about exercise, we talk about resistance exercises, we talk even about exposure to sunlight. Now, it is a very compounded effect because the muscles and bones are all one unit and we have to get them mobilized. And we have, like Supriya beautifully mentioned, we have long joints, we have small joints in the back also. So everything makes a difference. And if you use resistance band exercises and all, it is very much recommended these days. And it is the need of the hour because of our sedentary lifestyle. So Supriya put it beautifully very well. A lot of us are having a lot of issues, even doctors are having, because we have a sedentary lifestyle. Physical therapists are actually on the move all the time, isn't it, Supriya? So the bodies are active, the hands are active, and so they have to mobilize patients. So this is becoming one of the, I mean, we're giving the physiotherapists a lot of business at the end of the day. So we have to look after ourselves. Thank you so much, Supriya. Good day.
Thank you very much, Rotarian Dr. Ron Moniz, who himself is a doctor and an administrator of a very renowned medical college at Mangalore. Dr. Supriya, you have given the details. I am sure that everyone has got the answer. If anybody else, otherwise, I am doing the closing remarks. But before that, I will just say one thing, that the organs which people are considering them as a routine thing, they should think that they are very precious. Because if when we are talking about the organ donation is only possible if our organs are healthy. If our organs are not healthy, whether it's a living donation or it's a after the brain death, in both the conditions, organ has to be healthy, then only the organ donation can take place. So that is one aspect. Second aspect is when we are, if we suffer ourselves for the organ problems because of our many reasons. One of the reason is the not having a good lifestyle, and for that we require some guidance from the physiotherapist, which Dr. Supriya has explained today very nicely. So thank you very much, Dr. Supriya Khandelwal, for giving all the details and enlightening all the members of the Rotary Club of Organ Donation International, and those who are watching live or those who are going to watch afterwards. They can understand what type of advantages one can have with a trained, qualified physiotherapist instead of going to quacks and getting something which are damaging the organs, which is happening in many cases, and we are seeing in the gyms. It's coming very commonly that so and so actor collapsed or so and so person has died because of the wrong advice by the physical trainer or whomsoever. So thank you very much. Now I request Rotarian Professor Dr. Sudhir Saran to give vote of thanks.
Thank you. Thank you, Dr. Supriya, for a very clear, concise, and illuminating presentation. We learn every day, you learn every day, and let us keep the light of learning shared between us. The health is very important, and you made it very clear that our cause-based Rotary is for the organ donation. Donation is valuable only when the organs are healthy. So thank you for making us realize and showing us the way how we can keep our own organs healthy. Thank you very much for your time and effort. We are obliged. Thank you very much.
Meeting is hereby adjourned.